Yes, the first talk is, does this baby have any defective vision? Elucidating the milestones of visual maturation. Now I invite Dr. Anitha Prabhakaran to deliver her talk. She's a senior pediatric ophthalmologist at Precise Eye Care, Trivandrum.
A very good afternoon to one and all. First of all, let me thank KSOS for giving me this opportunity to have this IC. Many times we have many parents coming into our OPD deeply concerned about their child's vision. And we have often referral from pediatricians and from other colleagues, other ophthalmologists, and we may need to give them a definite opinion. A clear decision making is very much needed. So in this IC, we intend to take you, talk to you about what, where, when, and how of infant eye examination, various conditions and their management. We all know that children are not born with all the visual abilities they need for their life. And just like a child learns to walk and talk, over a period of time, they have to learn to see. And over every 2 months, they learn some kind of visual skill they acquire, and like focusing their eyes and moving their eyes more accurately, and to use their eyes more together as a team. And they use this information for stimulus as their growth as well. At birth, their vision is very less, at about 6/120, and it improves gradually over the few months. And only by the age of 2 years do they develop an adult visual acuity of 6/6. So we will just go through the normal visual maturation stages, because unless we know what is normal, we cannot identify or recognize what is abnormal, right? So we need to realize that at birth, the primary focus is on objects only 8 to 10 inches from the face, and that too, children cannot identify colors. They can only appreciate dark contrasting black and white images. By the age of 8 weeks or 2 months, they start to focus on their eyes on their parents' faces. And by 3 months, they begin to follow moving objects and start reaching for objects. And it's about by 5 months that they get their accommodation improves, their stereopsis improve, they get good color vision, and they have a better eye coordination as well. And when they start crawling at the age of 8 months, there is further development of the eye, hand, foot, body coordination. And it is supposed to, that parents should not, we should tell parents not to, fasten up and ask them to walk more quickly. Crawling has a role in even the eye development as well. So by about 10 months to 1 year, they are able to grasp objects and to judge distances much better. So just like it's not fair to expect an elephant to fly, we should not be expecting the milestones. We should know which all milestone to expect at what age, so that we can have a clear idea whether this child is normal or abnormal. So at each age, we need to do the age appropriate test, and as ophthalmologists, we have to know what all tests we can do at one particular age. So we have a preterm child coming to us. So here there are only two things we can do. One is a pupillary light reflex, and the other one is an external eye examination and a retina evaluation. So pupillary light reflex is possible, to elicit the pupillary light reflex from 29 weeks of gestation, and it shows an intact visual pathway, except that in cortical blindness it won't be contributory, and this should be done in all children. Now, when any child, like from newborn until 3 months of age, we have 9 tests we can do. Apart from pupillary reflex and the eye examination, we have blink reflex, red reflex, vestibulo-ocular reflex, eye popping test, fixing and following, OKN and VEP. So regarding the external eye examination, it should be done in bright light with a torch. Meticulous hand hygiene, washing with soap and water is very important in examination of infants. Child should be well fed and comfortable, and the one eye should be examined first for any abnormalities, and then we should examine both eyes together to rule out if there is any asymmetry or any other conditions. So the typical eye appearance has to be made out and any abnormality to be detected. Next is a blinking light reflex, where we can see that when we show a very bright light onto a child's face, even when the child's eyes are closed, they will show some discomfort if the vision is good. Whereas if the vision is poor, how much ever bright light we throw onto the child's eyes, they will not show any kind of discomfort. And this is also very important test we can do. The red reflex test, we all know, distant direct ophthalmoscopy, and we need to have the aperture in full open and zero diopter. We stay about 25 to 40 centimeter away and look at the red reflex. There was in 2022 there was a universal universal eye screening which was initiated by WHO, in which the pediatricians were encouraged to do the red reflex test and therefore detect the problems of newborns much earlier. Now, the doll's eye reflex or the vestibulo-ocular reflex, where the eyeball moves to the opposite direction as the head movement because of the semicircular canals and movement in the semicircular canals. And this test has to disappear once the fixation develops. Now, whenever we switch off the light in the room, the eyeball of the babies just pop out, and whenever we switch on, it again goes back to normal. So this can be again and again it can be elicited, and that is a very good test to know about the visual acuity. And fixing and following can be done until the age of about 1 to 2 months. They can fix and follow only horizontally, but after the age of 3 months they can fix and follow vertically in all directions as well. The two quantitative measurements can be, one is OKN and VEP. In OKN there is a black and white pattern which would be that would elicit a nystagmus, and VEP is the only clinically objective test for assessing the visual acuity. Now, when the child is over 3 months up to the 6 months of age, apart from these 9 tests, we can do 5 other tests as well. The first one being fixation behavior, and look for central steady maintained fixation, look for menace, reflex, Bruckner's test, and cover uncover test. So this method of testing for dolls eye was taught to me by my mentor, and here we can see that the child doesn't have a doll's eye. That is normal because the child has already developed a fixation, and we need to always look at the fixation behavior, whether the child is able to grasp the object or not. And then we need to look at whether the fixation is central, whether it is steady and it is maintained as well. Can be done with both eyes binocularly, and then you have to cover one eye and do unilaterally. Now in this child we can see that when I cover the right eye, the child is very comfortable, but when we cover the left eye, the child is trying to go away from it, and the child is resisting closure of the left eye. So in that case we need to have a suspicion that probably the child has a poor vision in the other eye. Menace reflex is when a sudden some threatening input is shown to the front of the eye, the baby will blink, and that is also an indication of good vision, which usually develops only by 5 months of age. Now it's similar to doing a distant direct ophthalmoscopy, but when we observe both the eyes together, we get what is known as a Bruckner's test, where we have the compare and we look at the asymmetry, and we can get an idea of the media opacities and the anisometropia and things like that. Now coming to the cover and uncover test, and this can be done in children more than 3 months of age and can identify any phorias and tropias. Dr. Rashmi will throw more light on it. Coming to after the 6 months of age until 1 year, apart from all these tests, we can do 2 more tests which are more quantitative, and they mainly depending on the preferential looking test method, which either Liag ratings or Teller visual acuity cards. We need to look at which thinnest stripe which the child is attracted to. Also, the Catford drum test also works on a similar principle, and the drum, when it is rotated, the smallest dot which attracts the attention. We know that all neonates need not be prescribed their glasses. The AAO recommendation is that only when myopia is more than -5 diopter, hypermetropia more than +6 diopter, astigmatism more than 3 diopter cylinder should be prescribed. But when there is an esotropia, a hyperopia of more than +2.5 diopter has to be prescribed, and whenever there is an anisometropia, the numbers are much lesser. So visual problems in infants are very important to be detected early because they can cause developmental delays, and we need to detect them early and treat them to ensure that babies develop visual abilities that plays a major role in the overall growth and development of the children. Thank you very much.